When it comes to explaining what health insurance reform means to you, who do you trust? Do you trust the defenders of the status quo, the people who say you'd be better off if you left things just the way they are? Or would you rather hear from the folks who actually know something about what's happening in our healthcare system because they work in it every day? Doctors and nurses.
Nurses in America know we need healthcare reform today. We can't afford to wait any longer.
My job and what I love about being a physician is what I can do for people. When I hear how unfairly they are treated by the insurance companies, it ruins my day, my blood pressure goes up. It's not fair.
These are the people I trust, and I know you do too. Ask them. Ask them if they think we should just leave things the way they are.
We have to have healthcare reform. The status quo is simply unacceptable. I think I get madder than my patients. They have been just beat up by this. As an American, this is not what we expect. We expect that when you pay your money for a product, you get a fair thing in return. And that's not what people are seeing.
You can talk to nurses in the emergency room or nurses in the operating room, and what you'll hear are these stories where people were scheduled for procedures, and then once it was determined whether or not they had coverage to pay for it or not to pay for it, procedures will be canceled. So you do see that.
I can't think of a single patient of mine who has private insurance who has not had some degree of stressors at that very critical time.
Nurses spend their entire day with patients, so you hear all of it. And then you see people losing homes. You see people selling their cars. You see people selling whatever asset they have to buy the health care that they need, to pay for the drugs that they need.
These are the folks who see it all. They see the children who should have gotten to a doctor earlier, the woman who would not have breast cancer only if she had gotten a mammogram, a senior who suddenly finds himself paying huge sums for their medications out of pocket because they've fallen into the gap in coverage, which has become known as a donut hole.
Those are the ones that break your heart the most, because many people are not fully aware of what their insurance covers and what it doesn't cover. It's a situation when seniors think they have something and they don't.
The status quo is simply unsustainable. But we're going to pass healthcare insurance reform. No more exorbitant drug costs for seniors. No more insurance company rules that deny you coverage when you're sick or prevent you from getting covered because you have a pre-existing condition. Health insurance reform is going to give you all of you, with insurance, security and stability. Insurance that is there when you need it, and there'll be affordable coverage for those who can't get it today. And it'll be fully paid for. We can do this without adding one single dime to the deficit. Doctors and nurses know that what they're seeing every day is wrong, and they know that we're going to change it. When it comes to something as important as your health, listen to the people you trust.